Topic of today's lesson: is it better to wait until all your hair falls out? Doctor: maybe I'll just wait until all my hair falls out and then I'll come in. This is a surprisingly common question in the clinic. Okay, I can answer you, but first let me ask you one question. Imagine you lose a tooth. You go to the dentist and say, you know what? I'll wait until all of them fall out. Then we'll fix everything at once. Sounds absurd, right? Exactly. Yet when it comes to hair, people sometimes think this way. In reality, you have two options. Option A, you wait, but that waiting can last decades. Hair loss usually slows down somewhere after your 50s. That means you might be waiting 20 or 30 years with less and less hair. Option B, you act, you transplant what has already been lost, you treat pharmacologically what is still there, and you enjoy your hair for as long as possible. And then I hear, but doctor, those medications. Yes, I know. Finasteride. Patients are afraid of it. But the truth is that for hair, we use a dose of 1 milligram per day. The same drug for the prostate, 5 milligrams. 5 times more, taken long term, and people somehow live with it just fine. And if anything doesn't suit you, you stop taking it. That's it. Then we look for another path. There are topical treatments, mesotherapy, and other options. So is it better to wait? For some people, maybe yes. But most of my patients prefer to have hair now, not the promise of a transplant in 20 years. There's no single answer that fits everyone. But there is one good piece of advice. Talk to a doctor before you decide. Not to the internet, but to a specialist who can guide you and show you the real options. And if you don't have your own doctor yet, well, you know where to find me. That's another lesson behind us, so I invite you to the next one. As you know, I don't check attendance, but it would be a shame to miss it.